You know that feeling when you're just staring at a massive stack of health insurance documents and your eyes just kind of glaze over? Well, listen, you are absolutely not alone in that. Welcome to this explainer. Healthcare can honestly feel like this giant maze of confusing jargon and super stressful deadlines. But today, we're flipping the script. We are going to take you on a journey from total healthcare confusion straight to absolute confidence. We'll be breaking down the core facts of the Affordable Care Act, or the ACA as most people call it. We'll look at exactly how this law protects you, how you can find the perfect coverage, and, honestly the best part, how you can get personalized help to make the whole shebang incredibly easy. So here is our quick roadmap for today's explainer. 1. Understanding the ACA. 2. Key consumer protections. 3. The health insurance marketplace. 4. Preparing your application. And 5. Getting expert help today. Okay, let's dive right into Section 1. Understanding the ACA, the basics of healthcare reform. To really get the most out of the Affordable Care Act, which, by the way, has been around since March 2010, we first need to understand what it's actually built to do. The law is essentially built on 3 primary goals, all designed to protect your health and, protect your wallet too. Goal number 1 is all about making health insurance available and actually affordable for more folks. It does this by handing out premium tax credits that literally lower your monthly costs, assuming your household income falls between 100% and 400% of the federal poverty level. Goal number 2 is expanding the Medicaid program to cover all adults with incomes below 138% of that poverty line. Now, quick side note, not every state has opted into this expansion, so keep that in mind. And the third goal, that's about supporting innovative medical care delivery methods, basically finding smarter ways to lower the overall cost of healthcare for everybody. Moving right along to Section 2, Key Consumer Protections, your rights under the law. Now, what's really interesting about this is how it completely changed the game for millions of people who used to be labeled uninsurable. Let's talk about pre-existing conditions. Simply put, this is just a health problem you had before your new coverage even starts. Under the ACA, insurance companies can no longer reject you or hike up your rates just because you have a pre-existing condition. We're talking things like asthma, diabetes, a previous cancer diagnosis, or even pregnancy. Once you're on the plan, they absolutely cannot refuse to cover treatments for those conditions. I mean, that is just massive peace of mind, right? If we look at how things used to be compared to now, wow, the difference is literally night and day. Before the ACA, insurance companies could basically put an annual or lifetime dollar limit on what they'd spend on your care. If you hit that cap, you were entirely on your own, paying out of pocket. Today, they cannot put a dollar limit on essential health benefits. No way. Also, back in the day, if you made a simple, honest mistake on your application, they could just cancel your coverage right when you got sick. Now, unless you're committing intentional fraud or just not paying your premiums, you are totally protected from those arbitrary cancellations. Plus, you have a guaranteed right to an external, third-party appeal if a claim gets denied. Another real game changer with an ACA plan is preventative care. And the best part? These services cost you absolutely nothing, $0. The system finally figured out that keeping you healthy is way better than paying for super expensive treatments down the road. So most plans are required to cover a core set of preventative services at no extra cost to you, as long as you stick to an in-network provider. This includes the basics like blood pressure and cholesterol tests, but also crucial cancer screenings like mammograms and colonoscopies. It covers well baby and well child visits, your routine vaccinations, and even your annual flu shot. And for all the parents tuning in, this next one is a huge sigh of relief. Young adults can now jump on or just stay on a parent's health plan all the way up until their 26th birthday. The flexibility here is just fantastic. They can stay on your plan even if they get married, even if they have their own kids, even if they don't live with you anymore or aren't in school. Heck, they can stay on it even if they're offered insurance through their own job. It's just an incredible safety net for young folks who are trying to navigate those crazy early career and life transitions. All right, Section 3, the health insurance marketplace, where you get covered. So now we know your rights, but where do you actually go to get one of these protected plans? Well, think of the health insurance marketplace as your ultimate official hub for getting covered. When you're shopping for ACA plans, this is where you go to preview all your options, compare prices side by side, and, this is the big one, check if you qualify for those premium tax credits we talked about earlier. Those credits are what really drive down your monthly premiums and out-of-pocket costs. Now, timing is absolutely crucial here, so you're going to want to mark your calendars right now. The yearly open enrollment window opens up on November 1st and closes on January 15th. If you want your new coverage to kick in right on New Year's Day, January 1st, you have got to enroll by December 15th. If you miss that one and enroll right at the final January 15th deadline, your coverage won't start until February 1st. And look, if you miss these dates entirely, you might be stuck waiting a whole year unless you qualify for a special enrollment period because of a major life event, like moving across the country or having a baby. So, the crucial point is that navigating this marketplace really just boils down to 4 simple steps. Step 1, get ready by pulling your documents together. Step 2, submit that application to get your instant eligibility results, which shows you exactly what savings or Medicaid options you qualify for. Step 3, compare the options and actually enroll in the plan that makes sense for you. And finally, Step 4, do not forget to pay that very first monthly premium directly to your insurance company. That is what officially activates your coverage. Which brings us to Section 4, preparing your application, what you need. Let's make that first step as incredibly easy as possible. You can just consider me your personal paperwork ally here. Having this stuff organized beforehand makes the whole process so much smoother. First up, you'll need the home and mailing addresses for everyone applying. This is just to prove your state residency, which dictates the coverage options you actually get. Next, you need Social Security numbers for everyone in the household. The marketplace uses this to officially verify your identity. And lastly, you're going to need your best, most accurate estimate of your household income for the upcoming year. This right here is the magic number. It's exactly what determines if you unlock those amazing tax credits and savings. I do want to touch on a quick little nuance here when it comes to your household. Your application is going to ask for information about everyone in your household, even the folks who aren't actually applying for health coverage themselves. Why? Well, because to the marketplace, your household generally means the people filing taxes and their tax dependents. So that includes your spouse, any kids living with you, and literally anyone else you'd claim as a dependent on your tax return. Getting this part right is absolutely vital so they can accurately calculate your savings. And finally, Section 5. Get expert help today, from confusion to confidence. We have definitely covered a lot of ground in this explainer today, from those sweeping federal protections right down to the nitty-gritty of tax dependence. If your head is spinning and it still feels like a lot to juggle, well, I have some truly great news for you. You don't have to navigate this crazy application process by yourself. Let me give you the ultimate hack for bypassing all this confusing paperwork. Just reach out to me. I'm Eric Burns, your licensed insurance agent. Working with a professional just completely takes the guesswork out of the entire equation. I'm fully licensed and ready to help clients across a bunch of states, including Alabama, Florida, Georgia, Mississippi, North Carolina, Ohio, South Carolina, Tennessee, Texas, and Virginia. Seriously, instead of wrestling with these forms on your own on a Friday night, let me give you personalized assistance. I'll make sure your application is absolutely perfect and that you are getting the absolute best plan with the maximum subsidies you're entitled to. The consumer protections are officially in place, the massive savings are sitting right there on the table, and expert help is literally just a phone call away. Please don't wait until those enrollment deadlines are right on top of you. Take control of your healthcare confidence today by calling me, Eric Burns, directly at 678-404-9230, or you can just shoot me an email. It really begs the question, right? If complete peace of mind and serious financial protection are just a quick phone call away, what's stopping you from claiming the health security that you and your family deserve? Thanks so much for joining me on this explainer, and hey, here's to your health.